won't necessarily get to influenza. We won't necessarily get, in passing, I might talk about it, and we won't necessarily get certainly to HIV, which are retroviruses. And again, I've been asked the question several times by students. I ask about the categories. So test-wise, and I sent you a bunch of stuff to review and look at. I sent you that thing for the herpes viruses. Several emails went out yesterday. I know, I was very annoying. And this morning I had something else to send you. So while I'm doing that, please read all. I mean, whether you want to listen to things or not, that's up to you. But reading them, at least know what's available to you. And so effectively, I ask categories. So if I say HIV is in what category, the answer key might be picoRNA viruses, rotaviruses, orthomyxoviruses, retroviruses, something else, whatever. I mean, that is by category. That's and a lot of those will be like matching type or just freestanding questions. So I want you to know the categories, or maybe it'll be a combination question on how it spreads, things like that. That's kind of the frame I wanted to give you to start the presentation now. All right, very good. So that's the starting point. So really, this is what we're talking about. And you might remember last time, just a mini review, the ones that all the naked viruses, we haven't got to this one, and this is really perhaps the most interesting of all the categories. Again, this is the one I gave you that anecdote about. We are seeing a little bit more of rotaviruses. Sometimes you see ROTO, depending on the author. Infantile diarrhea virus is really where it is. We're seeing more of it as our population changes, and we're getting an influx of folks from Mexico, Central, South America, and we start to see an increase because the folks, as it goes up the East Coast, it seems to be the traveling pattern, hadn't been used to it. But there is, my understanding, there is an immunization for that. Whether that's one of the regular immunizations, I do not know. You'll have to look at the schedule. I think it's an optional one depending on your area. That's just a guess. And I told you about norovirus, a real problem. And both of these persist on surfaces a lot. So a lot of times someone either is just shedding it, and that's the term we use normally, and we're going to get to the type when we get to asymptomatic carriers as well. People who are basically carry it and can expose people. We'll get to that when we start talking about how diseases spread, and that's the very famous typhoid Mary, which wasn't a virus at all, but a salmonella infection, a bacterial infection. And she carried it, and she was a cook, and she never got it. It was very challenging for the early epidemiologists. That was the turn of the last century in New York City, just giving you some context. There was a very good TV show from about 15, 20 years ago that was very offbeat, clever, called The Nick. I think it was on Cinemax at the time. You probably could find it with a little digging. See some things like that. But it's fairly accurate about what healthcare was like then. Which takes us to really the big category, and it really underscores the differences. Pico means teeny tiny. So these are naked viruses, picoRNA viruses. I call them picorna, it makes it easy. And again, they're isometric and they're naked. We got them all over the place. And it shouldn't surprise you that they're responsible for, we have two subcategories. Rhino, which means nose, and this is the common cold. There are about, and obviously respiratory spread, 200 or so different cold viruses. So people had toyed with the idea of finding, it doesn't make any sense to have a vaccine or an immunization because there's more risk of getting an immunization statistically than there is of getting a cold. I mean, even somebody who is immunosuppressed or things like that, don't let people not mistakenly inform you there are risks with every immunization. Because it's not a panacea, they are not innocent. People get adverse responses statistically all of the time. So you wouldn't make one and that's a take-home point, for something that's not a fatal condition. Okay. Colds are inconvenient, more so than anything else. One that may be a little bit more troublesome is spread differently, but it's based on size, shape, whether envelope or not. These are both RNA viruses, and that's an entero. Entero means enteric. Elementary count. Enteroviruses, basically, so when somebody says, "Oh, I was down with the stomach flu," it's not a flu. It's an enteric viruses. They're, again, easy to spread. These are spread fecal to oral. And so that's commonly some type of, and this covers a multitude, gastroenteritis, which means stomach, small intestine, large intestine. And we all know what the symptoms are like. Most of us have gotten it, particularly when in a dormitory or college or a barracks environment in the military. It just goes around like wildfire. Families, it goes around. Particularly with little kids, oh my God, because they don't wash and they touch everything. Did I mention don't have children to you previously? My wife and I made the mistake collectively 8 times. Well, joking. So, but interestingly, that's one category of this. The two biggest players, polio and hepatitis A. Unlike other viruses, for whatever reason, hepatitis, Hepatitis, you can spell it easier. Hepatitis A. There are a couple of exotic ones I won't ask you about. You'll hear exotic names in this category like Coxsackie, Kawasaki. I mean, they are viruses that are pretty severe. So if you get, for instance, in pediatrics, you have a child who has really severe gastroenteritis disease and high fever, and it doesn't clear rapidly, and you end up having to hospitalize them, you start looking closely, and you do a lot of specialized testing to see if it's a particular kind of virus. That's a whole different type. I mean, the severity merits doing these very sophisticated, expensive studies. So you have to have criteria in order to do them. I won't ask you about them. But when my daughter had chicken pox, they were good. They thought that this might have been, rather than just a bad case of chicken pox, which is what it was. They thought it might be one of those. But I got to tell you about polio, and I got to tell you about hepatitis A. They are both very relevant. Okay, you're all immunized for polio, as am I. Okay, and some of you may be immunized for hepatitis A, which was not available initially. Okay, which was not has been available, perhaps I would dare say, in the last 10 to 15 years. So you may or may not be. Whether or not that was advisable, again, I don't think it's on a mandatory list anywhere. The important anecdote is polio. Before we knew about it, and remember these are fecal to oral, we described it as infantile paralysis. A child with barely a symptom of anything could go to bed at night normal and wake up the next morning and not be able to move their legs. Totally insensate, no sensation, no loss of all motor function, loss of a lot of sensory function. Overnight. This virus, unlike other viruses, typically when you get a virus, we talk about this in epidemiology portions of it, how they spread. This one is fecal to oral to get, but is not contagious. Back in the 20s, when this was running rampant, at the turn of the last century, people had no idea it was coming from contaminated water. If somebody had polio, they wouldn't go to that house. They would shun people who were sick, not knowing what caused them. As far as they were concerned, it was contagious. They had no understanding. It was terrible. And what happened, and I treated people who got polio, who were just maybe 10 to 15 years older than I, who had that when they were children. People that a relative of my first wife, her aunt. I mean, all of those, it was rampant. And what would happen, it's absorbed by the gut. That's why it's fecal to oral. It goes to the nervous system, and it poisons nerves going to muscle. Remember when I taught many of you about muscles? When you had a stroke, it was called spastic paralysis. It was constantly sending signals to fire. Flaccid paralysis, when we talked about the central nervous system, was a classic example of the nerves going to the muscles not working, and the muscles began to atrophy without nervous stimulation. When there was recovery, Flexor muscles were much stronger than the extensors, and they developed all sorts of flexion contractures, a lot of intricate surgeries to try to get these people be weight bearing. That wasn't the worst part. What caused them to die with some degree of frequency was it ascended, typically started in the extremities and went centrally, and it was respiratory paralysis. They didn't have the respirators or intubation techniques that we have today. They had to put them in a thing called an iron lung. It was an iron encasement from here to here, and basically create like a vacuum changer that would create a pull and basically expand their chest mechanically so they could survive, if indeed they could survive. Dreaded disease, historically, you should read up on just for interest. The vaccine that was originally developed, and both the ones you have taken and I have taken, and the one that I have gotten, but you probably haven't, I would dare say, it was developed right here in Pittsburgh. It's called the Salk vaccine. It was by injection. They didn't know how it spread. It was landmark research, one of the most famous researchers because it was a dreaded disease everywhere. In the 50s, it was developed here at the University of Pittsburgh by a researcher named Jonas Salk. Interestingly, one of our emeriti, that's a professor who's retired, has a long list of accomplishments, who taught microbiology here, was a new doctor, a resident on that team. He actually worked with Salk. I can't remember his last name. When I came here about 20 years ago, he was teaching micro. Pretty good source of that. He's got he's got a Wikipedia page, that type of stuff. Just to give some modern context, if you will. He may even have a YouTube channel. He's also, are you ready? An expert on bonsai trees. Really? I maintain, please, don't get overly enthusiastic. I give up. My mind retains these little nuggets of information, and I don't know why. So, nevertheless, and I'm doing this for a reason. I do it all the time. That didn't work as effectively. There were like 2 or 3 shots because there's like 3. It's like trivalent, means there's 3 different strains. I got those shots when I was a little kid in the 50s. By around 1964, I think it was 65 to be exact, the entire country was re-immunized. The entire country. It was such a dread disease. When they found out it was fetal to oral, they did the vaccine here. It's called the Sabin vaccine, who was a researcher with Salk, who may have even been a relative of his. And what they did, imagine this, the entire country, about a month apart, went to, on a given Saturday, went to the church. Ours was at the high school. It might have been at the community center, might have been in a big college. All the doctors and all the nurses in the community, along with the public health officials, got a copy of the census, and everybody got the vaccine orally. You can ask grandparents about this. They came in, okay, my mom and dad and I and my sister would come in, bang. My sister was in college at the time. And they gave you a little sugar cube, and we used to use sugar cubes a lot. You can still find them in the store. They put a drop of a red vaccine, and in front of them, you basically let it dissolve in your mouth, opened your mouth, it was gone, see it. We did that on successive Saturday, not successive, but monthly apart, over the course of, perhaps it was the spring or the fall, I don't know exactly. To give you an idea how times have changed. On one of the days I was doing it, I slept over at a buddy of mine's house. Okay. My dad called his dad first thing Saturday morning. He said, hey, you want us to come over and get Lou? Because we're going over to the high school to get the vaccine. And his dad said, no, we're going a little later. The kids are sleeping in. I'll play it outside. I'll take them. And my dad said, okay, we'll tell them you're taking Lou. I got there with that family. I gave them my name, and they said, oh, your mom and dad were here. That's okay. Give them the vaccine. Can you imagine, ladies and gentlemen, in today's litigious is the word, that a 14-year-old kid will be given a vaccine without his mom and dad present, without a slew of documentation and lawyers on it? Can you imagine that? The teaching lesson is here. Be very careful. It's very easy today. That's not something you can't possibly have happen. You know that, oh, his mom and dad said it's okay. It doesn't work no more. You say a mile. Be clear. That buddy of mine is still a lawyer practicing in Southern California. Boy, he has much better weather than we do. Just saying. Okay? So that's the teaching lesson there. The other one, Pittsburgh roots, hepatitis A. The worst outbreak in this country, hepatitis A happened, is called infectious hepatitis back in the day, fecal to oral. It was not as dangerous as you would think, unless somebody was really sick and immunocompromised. Hepatitis inflames your liver. One of the things it does with an inflamed liver, it creates jaundice. Basically, your skin becomes yellow because your liver can't get rid of the breakdown product of blood called bilirubin. Did you do blood yet in A&P? The bilirubin, gallstones can cause it, liver disease can cause it, pancreatic disease can cause it, hemolytic anemias. There's a lot of reasons why it can be caused. And so it's characterized by jaundice, a yellowish cast of the skin, and sclera, fingernails, etc. This happened in a restaurant that was already in bankruptcy and effectively closed it. It happened in a restaurant, a Mexican-American restaurant, whatever the appropriate term is today's lingo, is called Chi-Chi's. And it was right off the Pennsylvania Turnpike at the Beaver Falls exit. And when you're on the Turnpike and you want to stop to get something to eat, whether you're wherever the heck you're going, you stop. And that's how it spread all over. 1,000 people. One of the gals in the morning class, she had a teacher from her high school that got hepatitis. 4 people died. And it wasn't just very old, very young. It was 4 people of all, people our age, your age, rather. Okay? Just to show you that in a wide area like this, and the big problem with spread is nobody knew it. It came from green onions, scallions, spring onions, whatever you want to call them. They were, and this is the other thing, the other teaching note from this, for home. They, like everybody else, you go to Walmart, you get the same package of scallions. And a plastic package says product to Mexico. Okay, wherever they got them, and it happens from this country, it's not, don't cast any aspersions, okay, about that. Every fruit and vegetable you get is supposed to be power washed, particularly ones that come from the soil. They power wash them with water to clean off all the dirt and debris because it comes from fecal contamination, typically human. And it isn't just in Mexico, but in the United States. If you go to in California, where a lot of these things grow, let me put it this way: there are no porta potties in the field. Got it? Pickers go where they go. Please, I'm telling you exactly what happened. That's the reason you got to wash everything. The fact that it says pre-washed, wash it. Particularly stuff like that. What happens is, and they did not, when you got to Chi-Chi's, it came from garnish. Not from ones they put in the sauce, and not the ones they made a sauce. Heating it would have destroyed it. Okay. But when it was put on raw for garnish, like I do with a ton of dishes, I have chopped cilantro and chopped green onions and spring it over when I'm doing Asian cuisine, Caribbean cuisine, etc. Everybody does. Got the point? And that's really what you need to know about that. The anecdotes, I know they're boring after a while, but understand there's a purpose behind why I do crazy things like this. It helps you remember. Next, now we get everything else is enveloped. Rubella. Rubella is chickenpox. The MMR shot that you all got. If you're my age, you got the chicken. You got the German measles. I beg your pardon, said chickenpox. Rubella is that. So measles, mumps, and rubella, the chickenpox or varicella vaccine, is separate and came later. We all got those. German measles or rubella is, you hardly would notice it. I had it, went to school, okay, with a low-grade fever, maybe a little rash that was typically coming in this neck of the woods here, hardly noticeable. It looked like maybe you're out in the sun too long, and you felt lousy. I mean, at most you stay over a day or two. That was not the problem. The problem is you're contagious a lot. And that led to particularly nasty things happen to women who were pregnant or about to get pregnant. It caused significant damage to the nervous system. We'll talk about it when we talk about, because it's classified as a skin disease. Rubella is mild to the person who gets it, horrible to the unborn child. Not to the mom, but the unborn child. That's a virus that crosses the placental barrier. More about that. That's why the vaccine is there, not for the disease, for the complication, not directly on the person, but indirectly on some people in their orbit. And you're coughing and sneezing long before you get that low-grade fever. That's the problem. A lot of these things, before you think you're sick, you're already contagious. Chikungunya is in the same category. This is enveloped. It's called toga. Toga means cloak. For whatever reason, they thought this envelope looked like a cloak. I don't know. Okay, chikungunya, we're seeing that's vector-borne, so it's two different ways. Rubella is respiratory. Chikungunya is vector-borne by mosquito. They came from Africa, and for whatever type of produce or materials, the first place that they would dock and these mosquitoes would get loose that were on the ship typically was in the Caribbean. And so a lot of you, look, God bless you if you're going to an island for spring break. Take me along. I can fit in the suitcase. I mean, my wife will kill me, but we have to watch the great grandson on St. Patrick's Day. But maybe I can get a pass. I'll try to fit. I'll lose some extra weight. See, that was clever. Give that one a thumbs up. Seriously. Anybody else? You're asleep in the back. That was a down?
Yeah.
Okay.
We're not going anywhere fun.
You have team stuff to do. Training. Nevertheless, okay, that's where you have to be careful. Most of these are mosquito. We'll talk some more about mosquitoes when we get to the next category, flaviviruses. If you're going there, and a lot of people like to go, you've got mosquitoes are everywhere. So you have to make sure appropriate steps are being taken. We have very little problems with them other than with standing water, particularly in warmer weather around here. We don't see as many mosquito-borne diseases. Well, and we'll get into this neck of the woods in a second. But there, a lot of people like to take a more rustic approach rather than staying in a big hotel or resort. I mean, they'll get, cottages on the beach. If they have mosquito netting, it's there for a purpose. Because that's usually when they get you. So be advised. I mean, you've got to be thoughtful about this. How many of the nursing students the trip used to be to Nicaragua before things got a little uncomfortable there. Now it's in Ecuador. But I mean, and the mosquitoes were in it, and the disease that was most problematic, because I asked Dr. Ross when he was teaching here, and he just retired, okay, he was worried about dengue. And that's mosquito-borne as well. He said it wasn't a big deal. They never really had a problem, but that was the one in the back of their mind that they were concerned about. So that's just for context. I'm not going to ask you about chikungunya, but it's something we're seeing more of. Rubella, you better remember. We examined that a couple of times. That brings us to flaviviridae. Flavus, somehow in Latin means yellow. I don't know. Not good in Latin. Riboflavin is a B vitamin. Often if you see it in an IV and they put vitamins in it for people who are malnourished or homeless, people coming in bad shape, you'll have a yellow IV. I mean, that's usually riboflavin. It's there. Just you might have gotten that nutrition if they talked about B vitamins. Don't know. So the yellow came because of jaundice. And most of them have an effect on the liver. The poster child, probably where it got its name, was yellow fever, because you had a high fever and appearance of jaundice. And undoubtedly it affected the liver, or somehow affected the bloodstream and broke down so many red blood cells you couldn't get rid of the product we can't recycle, which is called bilirubin, which comes from the heme. You guys did the blood unit already? Okay, so you remember the hemoglobin molecule, those four hemes, the metalloprotein with the iron. You can recycle the iron, but not that complex. That's what gives color to our urine and feces. You probably should have been made aware of that. But yellow fever, dengue, those are all fevers that are highlighted. We'll get to hepatitis. Zika is a little bit different. So other than hepatitis C, all of these, and West Nile virus, which we occasionally get up here because it comes from, it's sometimes carried by birds and then subsequently by mosquitoes. It's my recollection. You'll see that occasionally here, and you certainly see it in the United States with any of these in areas that are more mosquito prone than we have here. And they spray for the mosquitoes. So when they dug, this came to our acquaintance when the Panama Canal was being dug. We had no idea about it, and because that was you're going through a rainforest in Panama to connect into the Atlantic and the Pacific. Back in the 1890s, people were getting sick in droves. 1880s, 1890s. The natives said, "We've got yellow fever." They had all those. He goes, well, "What are we going to do?" And they introduced them a plant that made quinine alkaloids, and these quinine products were very, very handy in treating this, as well as because they didn't have a lot of medications. We still use them today. They're the major arm of treating another tropical disease that's carried by mosquitoes, which is in a different category because it's not a virus. It's a parasite called malaria. And we'll get to that later when we start talking about antiprotozoans and antivirals and stuff like that. But so most of these, the yellow is from its name. Zika came to light when we went toward the Amazon and the rainforest during the World Cup and the Olympics in 2014, 2016. And they discovered a virus where children were starting to present, because they were preparing for a couple of years in advance for these venues, and children were being born with slightly small heads. And it turned out it was Zika. And then we began to see little clusters in Florida with families who had either come from there and were carrying the disease, probably bitten by mosquitoes and carried by mosquito from one to, let's say, a pregnant woman. I mean, you hear about it. It's not like something that's prevalent. It's all about areas where mosquito control. There's an old saying, and we talk about this when we get to the epidemiology, how things spread. Control the vector, control the disease. And we haven't even gotten to rabies, which is the one you'll probably have the most context for. Lastly, and as important as any in this category, and we visited a couple of times, hepatitis C. Hepatitis A typically is not fatal. This was unusual because there were so many people who were affected, and maybe that's not an unusually high fatality rate. Hepatitis B, which we have an immunization for, and a lot of people have been immunized and or exposed and did not require immunization. I was in that category. Okay, for hepatitis B. That was what we used to worry about back when I was entering medical school 50 years ago. More than 50 years ago. Hepatitis C is the big culprit now. Hepatitis C is in that category of flaviviruses. When that liver gets inflamed, you get that yellowish appearance. The big problem is for years we had nothing to treat it really effectively with. The treatments were as harsh as the disease. It is nothing you want to have. At least now we have antivirals that are being tailored specifically to hepatitis. Both hepatitis B and hepatitis C, and this was in the handout I sent to you, from them we see liver cancers. It's different. It's an RNA virus. It's in the frame of RNA viruses as they mutate. Okay? Hepatitis B and C are fairly constant. Why they lead to cancers, it's not like distorting the DNA. The liver is probably the most, in you and I, the tissue that replicates most rapidly. We're constantly repairing and making lots and lots of liver. We can do live liver transplants. You can take a piece of somebody's liver and give it to somebody who's compatible. Years ago, we had somebody that died in order to have a liver transplant. It's a totally different world. That's the good news. Bad news is those cells, when they're damaged by this virus, the damage can proliferate, unfortunately, into people, particularly people who are ill, and a lot of these people have drug use, and it clearly is an STD, both hepatitis B and hepatitis C, so you must remember that. And typically this is spread It can be spread by intimacy. It can be spread by needles. It can be directly in the blood. And I told you the anecdote about my wife from 1981. No, yes. Good. This should wake you up. Okay. My first wife was an RN with a BSN, what many of you are trying to get. She was running a nursing home evening and weekend. She was evening weekend supervisor in a nursing home no longer there in Wilkinsburg. Now it's a senior citizen high rise. Hundreds to 200 residents. So she was in charge. She's doing all the blood draws all evening and all weekend, 2 12-hour shifts. Good money back then. This was 2003, 2004, like 2001 through 2005. I got this horrible call when I was adjuncting somewhere. I don't remember exactly where. I could hear the tears. Oh my God, I tested positive for hepatitis C. She figures you're going to die. She's scared. We really didn't understand what was going on. It was rather difficult news to hear. Okay. So this is the teaching point. She had gotten a blood splatter. She was doing blood. She did all the blood draws on the evenings and the weekends, particularly at night. And a patient, and you get a splatter. She didn't wear eye protection. She didn't wear glasses like I do. Most likely that's how potentially she was contaminated. She wasn't going to get. She was minor. I rushed myself up. It was fine. I didn't even get stuck. The directors of nursing insisted that she go to occupational health and they do a battery test for HIV and all that stuff. That's where the Hep C came up. It was unlikely that's where it came from. That's how it was discovered. She had a blood transfusion when she was having ovarian surgery when we were trying to get pregnant back in 81. The blood was not that safe then. 1987 is when the blood bank began to screen a lot more effectively for HIV and hepatitis C. Most likely that transfusion was the cause, I think. All that aside, the teaching point for you, some people may know this already. You're going to be in an environment there where you're going to get stuck. You're going to have waste products thrown at you. I'm telling you what's going to happen. You're likely to get bitten, scratched. Every time that happens, you report that to your supervisor and you insist that you're going to file an incident report. The only thing that's going to cover your precious posterior, we have an old expression called CYA. You know what the A means. If you don't do that and you get sick, you have and you're going to run into supervisors who don't want, that's going to make me look bad. It'll be okay. If there's a problem, we'll work on it. No. It's your job to report that. Understand that. I mean, you're going to run into supervisors who do not want that because it's going to tarnish their record. My wife this day, in a nursing home where she worked with a supervisor who was horrified. Oh my God, I could lose my license. It's part of the deal. My wife was a CNA before she became an LPN. And CNA, they were getting an old lady up, had to go to the bathroom, and 2 people, they were lifting her up. My wife bent down to get the potty chair in place, and she let go. All over her hair. She shrieked. You would have, whatever the appropriate tense of shriek is. And thank God they got her, they got the lady situated, and they got her into the shower. And I mean, because her hair is, that's her favorite thing. You know, she's it's like, oh my God, her hair. True story. If that happened to her, guess what? There's a lot of caveats to that. So I thought, I know it's being a little wordy, but I want to let you know that's why incident reports are there, because if God forbid something happens, that way you're covered. If you have to miss time at work because something bad happened to you, that's how you get compensated. That's why the good Lord made disability insurance and liability insurance. That's what hospitals are full of that stuff. It's an old saying, they're your employer, they're not your friend. You may have friends there who are really nice people. You work for them, you provide them with a service, they provide you with benefits. Just follow the procedure. Which brings us to Corona. Now, we'll spend a lot of time on coronavirus for real, but it's been around longer than you think. Corona means a crown. Okay, so they looked at this kind of unique capsid, and it looked like a crown. See that little where the protein spikes are coming out. It is not just all these bad guys. Coronavirus has caused a common cold forever. It is probably pleiform, meaning it's not one of all these others so far been effectively isolated. This kind of odd shape is odd because it probably can change a little bit. So pleiform is like a term we get when it doesn't quite have the typical shape of either being filamentous or isometric. So for years it just caused colds. The problem is with RNA viruses, and this is really the poster child in a lot of ways, along with influenza, is mutations. RNA, when we replicate RNA in our bodies, whether it's a virus using the machinery to replicate or the virus replicating in and of itself somewhere, RNA is very genetically unstable. It can mutate easily. DNA, again, more often goes latency. I mean, you can get both. When we make DNA in our bodies, we have a lot of safeguard mechanisms. In general, bacteria mutate about 1,000 times more frequently than our cells do. We make billions of cells every day, billions. We have occasional mutations, statistically you have to, but we have mechanisms. There's a fancy one that I comment on a little bit down the road called DNA polymerase 3. That's an enzyme that we have that bacteria don't have, and it's a proofreading mechanism if there's error in DNA. And it corrects it. Not only can it identify it, can appropriately correct it very successfully. That's just one of the reasons. There's many. What happens in these RNA viruses, so I guess the best one to tell you about that works similar but not identical, in influenza, it has 7 to 8 single strands. Only one I care about for strands of this is influenza. Single strands of RNA. And what happens in influenza, occasionally a piece from here will change places here, and maybe a piece from here will all of a sudden change places here. So you get this virus, and it's a phenomena called and we're going to go over it again when we talk about the flu, called antigenic drift. This subtle drifting, tiny changes, alter, and it happens all the time. That's why. So it alters them genetically, and when we make a vaccine, we make it based on the genetics. And epidemiologically, what happens, we study flu around the world, and usually about 3 to 6 months, typically at least 6 months. So in the summer of this year, we'll be thinking about what are the 3 most likely types of flu for next flu season. And the reason why the flu shots don't work, you can't use last year's, is it's totally different because of this drifting, this subtle changes. It has to do with how they attach and how they get loose. And that's something we're going to probably be talking about a little bit more on Friday. What happens with what causes these, what we call novel, Novel, or new viruses like SARS, MERS, and COVID-19, all in that category, is something called antigenic shift. A shift means these are viruses where you have a different species has a virus. And remember, this only has 1 strand, much less 7 or 8. And somehow a strand from a bird or a bat or some other organism manages to magically get over here. So all of a sudden you have another strand from another species. We call that novel or new. And those are the ones, and the ones that happened historically, we identified one in around 2000 called SARS, which stands for Severe Acute Respiratory Syndrome. It came from, at least the person who was carrying it was from Japan, and they took a flight from Tokyo, a long flight, to Toronto when they had the disease actively. They were coughing and spreading it. And a plane's a bad place for that. and a number of people died. Not a ton, but enough people that was the first real notice we got of something called SARS, when we saw a coronavirus could do more than just cause a cold. It had mutated. When in 08 and 09, maybe let's say during the Iraq campaign, during that period of time, let's say from 5 to 9, a lot of people, boots on the ground soldiers, and other members of the military effort that was there, developed something called MERS, Middle East Respiratory Syndrome, another COVID virus that had mutated. And like what happens a lot of time in wartime, things that they got in Vietnam came to this country that we hadn't seen before. Things from Iraq came to this country that we hadn't seen before. So whether or not it came from there, and typically how they come together is kind of the theory that a lot of people subscribe to about COVID. So COVID-19 clearly came from Wuhan in China. There's a lot of narratives. I do not know which one is correct. I'm not going to sit here and say it's some ulterior motive that this was an attempt at bioterrorism. I that's stupid. I have no foundation to say that. There's all sorts of possibilities. And we do another unit on COVID with respiratory. But effectively, they have a giant open air market where it's very easy, where you have pigs and you have cattle and you have poultry and you have people all together, and it's jammed, millions of people. I mean, the city alone's got a couple of million people in this giant market. And since it's respiratorily spread, all of these, you can imagine the farmer is sitting there with the pig coughing and the horse coughing and the poultry coughing. And that's basically when you get this novel virus. It means you get RNA from another species that's never really been combined before. And they had bat in there. Not that they're finding bats to be a delicacy, not that I know of, but bats are a common part of it for that particular virus. They were also doing experimentation in that laboratory with COVID viruses, and it was experimentation. They're looking for something that potentially could be weaponized, and they're looking for something that, if it does become weaponized, is there a way to treat it? Now, whether it was released by intent or by accident, or whether it had nothing to do with that laboratory, I don't know. But they were certainly researching those viruses. I mean, I'm not a conspiracy theorist. I'm just giving it to you for context. But the problem is here, these novel viruses rear their ugly heads. That's kind of how some of the flus we'll be talking about when we do influenza became part of the lexicon. So I wanted to complete that. These are pretty easy. Undoubtedly, we'll start these other ones because I just finished these two, and because they're relatively quick. Those are the true filamentous viruses that are enveloped, rhabdo and phyllo. Rhabdo is the one you're the most familiar with, of a zoonotic virus. And again, how it's transmitted is the usual way it's transmitted. It can be human to human, but typically it comes from a manner of the animal kingdom to us by being bitten, by contact with their saliva, interestingly, bat urine, which you probably should be addressed. You and the bats don't want to get close together. Bat urine is bad juju. So if you like to go caving, that's one of the things you have to be very careful with. Okay. My stepdaughter was going to do like a research program where they went into caves and were counting, because bats are interesting. Other than that, it's okay. I try to stay away from that kind of stuff, but I digress. So rhabdo is specifically for rabies. Rabies are effectively, if you don't know that an animal you encounter in this environment, particularly mammals, but whether it's a dog or a cat, a bat, they're all mammals, a squirrel, a chipmunk, a fox, raccoon, those are all potentially rabid animals. If you're bitten by a dog or a cat that you can't know for sure that they have received rabies prophylaxis, they have been immunized for it, you need to be treated for it, period. Years ago, the treatment was horrible. Now, with intraperitoneal injections, they were almost impossible to tolerate. Now it's just a series of, I think, 7 to 10 injections on a daily basis, one per day. Typically intramuscular, that's it. I had many students who worked for veterinarians. If they're bitten by an animal that they weren't sure about its rabies status before they immunized them, they had to have that done. It lasts for about 6 months. You're basically getting the antitoxin. It's not lifelong immunity. We don't use the same kind. The treatment for my dog or our cats is totally different. Okay, than because I don't know enough about the teaching of veterinary medicine. You got to be very careful with that. Don't assume. If you see, like if you're in a wooded area, like we have one very close to we live in what's called the Woodlands in Cranberry. I mean, if you see a dead animal there, I mean, I call the authorities and say, I haven't had to do that, but you should. You shouldn't be touching it and throwing. I mean, you don't want to play with fire. So understand. I think I mentioned that. Did I mention the anecdote about someone who was a neighbor of my former in-laws, psych nurse up at? Did I tell you that one? She's a psych nurse at the old St. Francis Hospital where I was on staff and operated out of. Is where Children's is today, up in Lawrenceville. Where they made most of their money was from alcohol and drug detox and a big psych unit. She was a psych nurse. Here's part of the story. She was treating a guy who was absolutely crazy. They had no idea what was going on with him. And she got too close when she was doing a treatment, and he bit her. And he died a few days later, and post-mortem, guess what? Rabies. She had to go through that rabies series. It can be transmitted person to person, saliva. And she had to have that whole routine. And she didn't work for months because, I mean, it was just extraordinarily painful. I mean, it was just bad. So, again, incident reports, watch out, contact can come from anything. You find those things out. And it's an absolutely true story. And I had to do that. I told the other class with my daughter almost done. I'll say, remind me, we'll start with Ebola in this class. And my daughter, we went on like a dads and daughters Y group when she was little, like first or third grade. And we were up at a Y camp up by Camp David outside Somerset. There are chipmunks everywhere, and the little girls are woke. They think they're Alvin, Theodore, and Simon. And I'm like, don't touch them. Oh, they're so cute. I want to pet them. No. And all the other dads they're all lawyers. It's like, you're a bunch of lawyers. You know what's going on. Absolutely true story. Oh, Dad, they're so cute. Stand. So a message, word to the wise is sufficient. All right. Take care. Goodbye. Have fun. Remind me, we're starting with phyllo. Not phyllo dough, but phylloviruses.